10 Bad Signs of Sjogrens Syndrome You Should Never Ignore. Hello everyone, and welcome to today's in-depth look at Sjogrens Syndrome, one of the most misunderstood and complex autoimmune diseases impacting millions worldwide. And in this video, we're going to explore the 10 most concerning signs of this often overlooked condition. Despite affecting nearly 1% of the population, with women being 9 times more likely to develop it, Sjogrens syndrome remains underdiagnosed and underdiscussed. What makes it so challenging is how easily it mimics other diseases, often leaving patients without answers for years. On average, it takes 7 years for a patient to receive a proper diagnosis. That's 7 years of debilitating symptoms, misdiagnosis, and feeling like no one is listening. In today's video, we'll break down the 10 critical warning signs that should never be ignored. Whether you're a patient, a caregiver, or just looking to understand this condition better, this could be the insight you've been searching for. Now, let's begin with the most common and telling sign of Sjogrens syndrome. 1. Severe dryness. The hallmark of Sjogrens syndrome is extreme dryness, but this isn't your ordinary dry eyes or occasional dry mouth. It's a life-altering level of dryness that affects multiple body systems simultaneously. Patients often describe their eyes feeling like sandpaper is constantly scraping against them, causing burning, redness, and a sensation of having something gritty trapped under the eyelids. This severe dry eye condition, called keratoconjunctivitis sicca, occurs because the immune system attacks the lacrimal glands that produce tears, significantly reducing tear production and quality. The impact on vision can be profound and frightening. Many patients experience blurry vision that fluctuates throughout the day, increased sensitivity to light, and difficulty with night driving or reading for extended periods. Without adequate tears to nourish and protect the cornea, patients are at increased risk for corneal ulcers and infections that can permanently damage vision if left untreated. Imagine trying to get through your workday when your eyes feel like they're on fire, and you need to apply artificial tears every 30 minutes just to function. This is the reality for many Sjogrens patients who find their productivity and ability to concentrate severely compromised by this relentless symptom. The mouth dryness, xerostomia, is equally devastating and goes far beyond mere thirst. Patients often report waking up in the middle of the night gasping because their mouth and throat are so dry they struggle to swallow or speak. The lack of saliva affects taste, making food bland or metallic, and creates difficulties with chewing and swallowing dry foods like crackers or bread without constantly sipping water. One particularly disturbing consequence of severe mouth dryness is rapid dental deterioration. Saliva plays a crucial role in neutralizing acids and protecting teeth from decay. So when production diminishes, patients often experience an alarming increase in cavities, despite maintaining excellent oral hygiene. The dryness doesn't stop at the eyes and mouth, it affects the entire body. Many patients experience uncomfortable dryness in the nasal passages, leading to frequent nosebleeds and chronic sinusitis that doesn't respond to typical treatments. Throat dryness can cause chronic cough, hoarseness, and difficulty speaking for extended periods, severely impacting social and professional interactions. For women, vaginal dryness is often a particularly distressing symptom that can make intimate relationships painful or impossible without intervention. The skin also becomes notably dry, itchy, and prone to cracking, especially on the hands and feet where painful fissures can develop and become entry points for infection. What makes this dryness particularly devastating is its resistance to simple remedies. Regular eye drops, drinking more water, or standard moisturizers typically provide minimal relief. The dryness of Sjogrens is relentless and requires specialized treatments and constant management. Many patients carry a survival kit with multiple types of eye drops, mouth sprays, and other moisture-restoring products wherever they go. This extreme dryness isn't just uncomfortable, it fundamentally alters how patients interact with their environment and can lead to social isolation and depression as simple activities become challenges. The constant discomfort serves as a perpetual reminder of the disease's presence, rarely allowing patients a break from symptom awareness. 2. Debilitating fatigue. Among the most devastating and poorly understood symptoms of Sjogrens syndrome is a relentless, all-consuming fatigue that defies comparison to everyday tiredness. This isn't the sort of weariness that improves with a nap or a good night's sleep. It is a deep, systemic exhaustion that pervades every cell of the body and mind. Patients frequently describe it as walking through wet cement, carrying an invisible weight, or enduring a flu-like state that never truly subsides. Unlike typical fatigue, which follows exertion or sleep deprivation and dissipates with rest, the fatigue associated with Sjogrens often strikes without cause or warning. It can descend suddenly, rendering even the simplest tasks, getting out of bed, brushing teeth, preparing food, monumental challenges. Many patients wake after 10 or even 12 hours of sleep feeling no more refreshed than when they closed their eyes, beginning each day already depleted. This fatigue is not merely physical. It is multidimensional, profoundly impairing cognitive function as well. Patients report brain fog, difficulty concentrating, slowed thinking, and memory lapses that interfere with work, communication, and decision-making. These mental symptoms are often as disabling as the physical fatigue itself, creating a sense of mental detachment and diminished capacity that can be frightening and frustrating. For many, energy becomes a precious, dwindling resource that must be meticulously rationed. This energy budgeting means making difficult decisions, whether to shower or attend a child's event, whether to cook dinner or fold the laundry. Activities most people consider routine become strategic choices, and overdoing it even slightly can trigger a crash that requires days of recovery. The unpredictability of these energy fluctuations compounds the emotional toll, leaving patients hesitant to make plans, attend social gatherings, or commit to responsibilities, knowing that the fatigue could surge at any time. The burden of Sjogren's fatigue is made worse by the medical community's inconsistent recognition of it. Despite evidence linking it to neuroinflammation and immune activity in the brain, it's often dismissed as psychological or due to poor sleep, leaving patients feeling ignored and unsupported. Conventional fixes like rest, caffeine, or supplements offer little relief because this fatigue isn't about being tired, it's a systemic immune-driven exhaustion beyond willpower or lifestyle. Its impact is significant. Up to 60% of patients reduce work or stop working entirely. Social lives suffer too, as fatigue forces withdrawal and isolation, often leading to anxiety and depression, which further worsen symptoms. Validating this fatigue is crucial. It's not secondary or imagined, it's a core symptom of Sjogren's that deserves serious attention and treatment. 3. Joint and muscle pain. The third alarming sign of Sjogren's syndrome involves widespread joint and muscle pain that can be as severe as rheumatoid arthritis, but often presents with unique, confusing patterns. Unlike the visible joint swelling typical in rheumatoid arthritis, Sjogren's patients frequently experience intense pain without obvious external signs of inflammation. This discrepancy often leads physicians to dismiss these complaints or attribute them to fibromyalgia alone, delaying proper diagnosis and treatment. The joint pain in Sjogren's typically affects multiple joints simultaneously and can migrate unpredictably throughout the body. Today it might be excruciating knee pain, tomorrow unbearable wrist pain, and the next day hip pain that makes walking difficult. This migratory nature can make the pain particularly difficult to track and treat, leaving patients feeling like they're constantly chasing symptoms with limited relief. Sjogren's joint pain often targets small joints like the hands, wrists, and feet, causing lasting morning stiffness and difficulty with everyday tasks, even when no swelling is visible. Simple actions like buttoning a shirt or holding a cup can feel surprisingly hard. Alongside joint pain, many patients also experience deep muscle aches, especially in the shoulders, hips, and thighs. This myalgia drains strength and can make basic movements like climbing stairs or washing hair painful and exhausting. Flares can strike without warning, triggered by stress, weather changes, or illness. During these episodes, patients often feel decades older, with even minor movements requiring major effort. This combination of joint and muscle pain is more than discomfort. It's a chronic, unpredictable challenge that disrupts daily life and demands careful management. 4. Neurological symptoms. The fourth concerning manifestation of Sjogren's syndrome involves neurological complications that can affect both the peripheral and central nervous systems, yet are frequently overlooked or misdiagnosed. These neurological symptoms can sometimes precede the classic dryness features by years, making diagnostic connections even more challenging. When Sjogren's affects the nervous system, it creates a confusing constellation of symptoms that may seem unrelated without understanding the underlying autoimmune process. Up to 25% of Sjogren's patients experience peripheral neuropathy, often felt as tingling, numbness, burning, or electric shock-like sensations, typically in a stocking and glove pattern affecting hands and feet. Small fiber neuropathy can cause intense, treatment-resistant pain that disrupts sleep and daily life. Patients often face unpredictable neurological symptoms, numbness, headaches, dizziness, or facial tingling, that appear and disappear without warning, creating anxiety and uncertainty. Cognitive dysfunction or brain fog is also common. Many struggle with memory, concentration, and word recall, symptoms that can impair work and self-confidence, especially in cognitively demanding roles. In rare but serious cases, central nervous system involvement can occur, mimicking multiple sclerosis. Conditions such as transverse myelitis or optic neuritis may arise, risking permanent neurological damage if not treated early. Effective management requires both immune therapy and symptom-specific treatments to support nerve function, cognitive health, and overall well-being. 5. Lung involvement. The fifth alarming sign of Sjogren's syndrome involves pulmonary complications that can significantly impact respiratory function and overall health. While often overlooked in discussions about this disease, lung involvement occurs in approximately 20% of Sjogren's patients and can sometimes be the first manifestation before classic dryness symptoms appear. The respiratory system offers multiple targets for the autoimmune process of Sjogren's, creating diverse presentations that can be subtle initially but progress to serious breathing difficulties if not properly addressed. A chronic dry cough is often one of the first respiratory symptoms in Sjogren's, commonly mistaken for allergies or infections. It worsens at night and usually doesn't respond to typical cough remedies. The cause is airway dryness and irritation from reduced mucus production, making the lungs more sensitive to irritants and infections. Shortness of breath can develop slowly, often noticed during simple activities like walking or climbing stairs. This can severely limit daily function and independence, requiring major lifestyle changes. The most serious lung issue is interstitial lung disease, ILD, where immune-related inflammation scars lung tissue, reducing elasticity and oxygen exchange. ILD progression varies. Some patients decline slowly over years, while others deteriorate quickly and need aggressive treatment. Bronchiolitis, or inflammation of the small airways, is another complication. It can cause wheezing, air trapping, and infection risk, but unlike asthma, it responds poorly to inhalers and often needs immunosuppressive treatment. Lung issues in Sjogren's can have lasting consequences. Fibrosis, lung scarring, once present, can't be reversed, only slowed, so early detection is vital. Pulmonary function tests, PFTs, and high-resolution CT scans are key tools, even for patients without clear symptoms. In some cases, bronchoscopy or lung biopsy is required. Breathing difficulties often trigger anxiety, which can worsen symptoms. Breathing exercises and symptom management plans can help reduce stress and improve coping. For those with significant lung involvement, avoiding smoke, chemicals, extreme temperatures, or high altitudes is essential. Some may need oxygen during activity or even full-time, representing another layer of adaptation in life with Sjogren's. 6. Gastrointestinal problems. The sixth troubling manifestation of Sjogren's syndrome involves extensive gastrointestinal complications that can dramatically impact nutritional status and quality of life. The digestive system, with its extensive mucosal surfaces and complex interaction with the immune system, provides multiple targets for autoimmune disruption in Sjogren's. These GI manifestations extend far beyond what might be expected from simple mouth dryness, affecting the entire digestive tract from esophagus to colon. Gastrointestinal symptoms are common and often overlooked in Sjogren's syndrome. One of the most frequent complaints is dysphagia, difficulty swallowing, caused by reduced saliva. Dry foods like bread or meat become hard to swallow, often leading to choking, especially in social settings. Patients often rely on liquids while eating, which can limit food choices and affect social meals. Esophageal motility problems may develop as the disease affects nerves and muscles in the esophagus. This can cause food to feel stuck, painful swallowing, or regurgitation, symptoms often mistaken for GERD and not fully treated with acid blockers. Gastroparesis, or delayed stomach emptying, is another common issue. It leads to nausea, early fullness, bloating, and weight loss. Eating can become uncomfortable and unpredictable, causing some to avoid meals, especially in public. The pancreas may also be affected, leading to exocrine pancreatic insufficiency. This causes poor nutrient absorption, fatty stools, abdominal pain, and weight loss, even with normal eating. Without enzyme supplements, patients may develop serious deficiencies. Around 10% of patients experience liver involvement, ranging from mild enzyme changes to autoimmune hepatitis or primary biliary cholangitis, PBC. These may cause fatigue, itching, or jaundice but often go unnoticed until abnormal labs appear. Some patients experience IBD-like symptoms such as chronic diarrhea, abdominal pain, and urgency. Conditions like microscopic colitis may mimic Crohn's or ulcerative colitis and flare unpredictably, making daily life more difficult. Celiac disease is also more common in Sjogrens. Combined with swallowing issues or gastroparesis, managing diet can become extremely complex, leading to unintentional food restrictions and nutrient gaps. GI problems also affect medication tolerance, as many Sjogrens treatments may worsen digestive symptoms. Choosing drugs that are easy to swallow and gentle on the stomach becomes crucial. Managing these issues often requires a team-based approach involving gastroenterologists, dietitians, and sometimes speech therapists. Treatment may include motility drugs, pancreatic enzymes, tailored diets, and immune-modulating therapies. Addressing nutrition and symptom relief together is key to improving quality of life in Sjogrens. 7. Cardiovascular complications. The seventh concerning manifestation of Sjogren's syndrome involves cardiovascular complications that can significantly increase health risks yet are frequently overlooked in disease management. The heart and vascular system are vulnerable to both direct autoimmune attacks and the consequences of chronic systemic inflammation characteristic of Sjogren's. These cardiovascular issues can develop silently before producing obvious symptoms, making regular screening and risk assessment crucial components of comprehensive care. Sjogren's syndrome can significantly impact the heart and blood vessels, sometimes with serious consequences. Pericarditis, or inflammation of the heart's outer lining, causes sharp chest pain, often mistaken for a heart attack, that worsens when lying down or breathing deeply. It can lead to ER visits before its autoimmune origin is recognized. Conduction abnormalities affect 5 to 10% of patients, disrupting the heart's electrical signals. These may cause palpitations, dizziness, fainting, or fatigue, and in severe cases, require a pacemaker. Small vessel vasculitis causes inflammation in tiny blood vessels, leading to skin rashes, poor wound healing, or if internal organs are involved, nerve damage and organ dysfunction. Sjogren's increases the risk of blood clots, especially with antiphospholipid antibodies, potentially leading to deep vein thrombosis or pulmonary embolism. Chronic inflammation also speeds up atherosclerosis, raising heart disease risk even with normal cholesterol. Heart involvement complicates treatment, as some medications may harm cardiovascular health, requiring careful monitoring. Cardiac issues often progress silently, so regular screenings and tracking of blood pressure and lipids are vital. The emotional impact, including anxiety and fear of activity, can worsen heart health and should be addressed. Prevention through a heart-healthy, anti-inflammatory lifestyle is essential. 8. Kidney and bladder dysfunction. The eighth serious manifestation of Sjogren's syndrome involves kidney and urinary tract complications that can threaten renal function and create significant quality of life issues. While less frequently discussed than dryness symptoms, renal involvement occurs in approximately 10 to 20% of patients and can range from mild abnormalities to severe kidney disease requiring dialysis. The kidneys, with their complex filtering structures and electrolyte management systems, provide multiple targets for autoimmune disruption in Sjogren's. Kidney involvement is common in Sjogren's syndrome, most often appearing as interstitial nephritis, a silent inflammation detected via lab tests. This can lead to renal tubular acidosis, RTA, causing fatigue, muscle weakness, and bone pain due to chronic acidosis and calcium loss. Hypokalemia from potassium wasting can cause cramps, palpitations, and dangerous arrhythmias, requiring careful supplementation. Less commonly, Sjogren's may trigger glomerulonephritis, presenting with proteinuria, high blood pressure, and swelling, potentially leading to kidney failure. Bladder issues like interstitial cystitis are also frequent, causing urinary urgency and pain, often mistaken for infections. Diagnosis relies on labs, imaging, and sometimes biopsy. Without treatment, kidney damage can become permanent. Management includes alkali therapy, potassium replacement, and possibly immunosuppressants. Drug dosing must be adjusted for impaired kidney function, requiring coordination among specialists. 9. Lymphoma risk. The ninth and perhaps most alarming sign of Sjogren's syndrome involves its association with significantly increased lymphoma risk, particularly non-Hodgkin lymphoma. This represents one of the most serious long-term complications of this autoimmune disease, with Sjogren's patients facing a 14 to 44 times higher risk of developing lymphoma compared to the general population. This elevated cancer risk stems from the chronic B-cell activation and proliferation that characterizes the disease, creating fertile conditions for malignant transformation in lymphoid tissues. Lymphoma risk in Sjogrens syndrome increases over time, about 4% after 5 years, 10% after 15 years, and up to 18% after 20 years, necessitating lifelong monitoring. Risk factors include enlarged salivary glands, low C4 complement, cryoglobulinemia, lymphadenopathy, monoclonal gammopathy, and purpura. The most common lymphoma type is MALT, often slow-growing, but aggressive types like diffuse large B-cell lymphoma can also occur. Warning signs include unexplained fever, weight loss, night sweats, persistent swollen lymph nodes, or asymmetric gland swelling. These require urgent evaluation. Diagnosis involves imaging and biopsy. Routine care includes regular exams, blood tests, and possibly baseline imaging. 10. Mental health. While often invisible, the mental health toll of Sjogrens syndrome is significant. Chronic pain, fatigue, sleep disruptions, and unpredictable flares create ongoing stress, often leading to anxiety and depression. Inflammatory processes may directly affect brain chemistry, worsening mood symptoms. The loss of identity, social isolation, and feelings of being misunderstood further add to the emotional burden. Traditional treatments may be limited due to medication side effects or the complexity of chronic illness. Still, with support and adaptation, many patients find resilience and meaning amid the struggle. If you found this information helpful, please subscribe to our channel for more educational content about autoimmune conditions and their management.